Let's talk about when someone has an ostomy but hasn't had rectum or anus removed. What issues would a male expect to or could come across in regards to sexual function?
So, here's the thing. The numbers when it comes to erectile dysfunction. So if you have had some surgery near the rectum, or you've had some removal of a portion of the rectum, the numbers will say 2 to 3% max may experience some change in their ability to achieve an erection. That's not a high number, but if you're the man, you're the patient, that's a big deal. Yeah. And no matter how a surgeon, for one, you should ask your surgeon that question. If they don't have an answer, there's a problem, okay? But they should have an answer. Ask them, how they try to prevent that. And they'll tell you that they take great care to make sure they don't cause nerve injury. And they're very good. Our techniques and the skill sets are so much more advanced than they used to be. But, there's no guarantee that a nerve may not be injured, even though it's so rare. So that's just something, it's hard, that's the honest truth. It's no one can give a guarantee that there won't be some change. The majority of patients, though, will not have an issue with achieving it if they've had some surgery. Now, what changes, though, Elaine, is if there is more deeper surgery, where there is if you had deeply penetrating rectal disease, or the pouch had to be completely removed or excised, then the more pelvic surgery there is a slightly increased risk of injury to the nerves that help send the signal to create an erection.
So if someone has to have their rectum removed, then what happens?
So again, the majority of my patients have not had issues with erection, but there is an increased risk of nerve injury, and there can be some erectile dysfunction.
Okay.
I will say that if you are a male and you are someone who has not undergone a proctectomy or has not had, but that may be something in your future, possibly. If your doc has said, hey, you may need some more surgery in this area, a rectum may or may not need to be removed, or we may need to do more pelvic surgery. One thing, if you're a male who wants to reproduce, okay, you may want to consider consulting with a urologist or a service that freezes your sperm. Everybody's different. And again, I have to emphasize as a doctor that my suggestions here shouldn't be a substitute for the medical advice of your own doc. And yes, everyone's unique, total unique.
To people who have a urostomy, how does that then affect the ability to get an erection?
It depends on why the urostomy was created, but it should not necessarily affect erectile dysfunction. One thing that can happen with the urostomy, though, is having a dry orgasm. So instead of having ejaculate, some men can have a dry orgasm where there's no amount of fluid or semen as you may necessarily be used to. So that can become a little bit of a shock or a surprise. When it comes to men who have gone through ostomy surgery, who've had surgery or a scar, I find, and this is just my own personal experience, that some men who are having issues with intimacy, the biggest thing when you get into it is that after surgery, they never tried.
All right.
They never tried. They just assumed or just had such low libido, they didn't want to engage their partner or try. This can result in tension and a missed opportunity. There was an interesting study, and this is what I wanted to get to. About 50% of men after surgery, so before surgery, who had their ostomy, were sexually active. And then after their surgery, about 50% of men chose not to be sexually active anymore. This is a small study, a little over 100 patients.
Wow.
It turns out of the other half of patients after surgery, after their ostomy, half of them tried, and 70% of them reported healthy sexual satisfaction. What's my point? You got to try, and don't assume that you're not going to feel satisfied and that your partner's not going to feel satisfied. So my big point is try, get yourself into the zone of sexy time. What's the difference? What's fertility? What's fecundity? Fertility means For men, that means, do your sperm swim? Do they function? Can they inseminate an egg? Fecundity refers to the ability to have a hospitable environment to create it, to take that egg and carry it through full gestation, through full 9 months to birth. For men, we're different. Our gonads are not inside our pelvis. They're outside our pelvis, right? They're temperature controlled in the scrotum, hanging down outside. So by and far and large, most men, after they've had surgery, their fecundity is not going to be affected because they're not taking the baby, right? They're just providing the sperm. So their fertility is not being impacted typically either. It's that sperm getting out, right? How does the sperm go from the testes out to be ejaculated? So the things that can affect that are nervous stimuli through either arousal from the sheer mechanics, a caress, a stroke, or the nervous stimuli from the brain down. That's another type of that type of arousal. And then also we talked about meds that can affect the swimmers, like sulfasalazine or asulfidine, which affect motility of the sperm. And then if you have active disease that actually penetrates near the testes, which for most Crohn's patients is uncommon. Otherwise, your fertility should be preserved. Again, getting the sperm out is the issue. So if there's an issue with erection or more pelvic surgery, you again may want to consider sperm banking.
Right. Then in regards to people who have gone through cancer.
And that's another certainly concerning thing. If you're undergoing pelvic radiation for like rectal cancer, certainly they try to make sure that the beam is focused only on the area that needs to be. So if you're a rectal cancer patient, you met with your radiation oncologist and they've kind of put beads and dots on you to map out exactly where they're going to, give the radiation, and they try to avoid the sexual organs. But it is a possible risk. So it's something, again, you should ask. I do want to stress, we always go to the doc and ask about, because I'm a patient for other things too, we always ask about the side effects and adverse events, but rarely do men, less so than women, that's for sure, ask about the sexual side effects. So if you are undergoing radiation therapy, ask your radiation oncologist. They'll tell you exactly, because they're trained to actually ask this question of their patients. How is your sexual life? How is your erection? How is your arousal post-radiation? It should be something that they're asking you anyways. You mentioned surgery. So we went from meds, radiation, and surgery. The deeper surgeries where there's more pelvic excavation are more associated with nerve damage and may have a higher risk of erectile dysfunction. So again, it's one of those things you have to be aware of. And you may want to check yourself with, what your insight or what your sexual desire and libido are before you undergo surgery. One thing I would recommend if you haven't undergone that kind of surgery for pelvic cancer is talking to another patient in your doctor's practice. Ask if anybody feels comfortable. Point is, don't be stuck in your bubble. Don't be stuck in these assumptions. There's help. You just need to go ask for it. And simple things might fix the issue that you might be having.
You can check out my website. It's elaineo'rourke.com. And please connect with me if you are struggling, if you are having problems with intimacy in regards to IBD, having your ostomy, if you have body image issues in regards to even communication. That's what I work with. I work with people in that capacity. So reach out to me, and please just follow me on, if you're a YouTuber, follow me on YouTube, Elaine O'Rourke, Yoga, Ostomy, IBD, Instagram on Ostomy, IBD Life, and Ostomy and IBD Life on Facebook.